First, I'd like to introduce Mabel Carabali from Colombia, who is trained as a physician and is currently actually doing a master's in epidemiology at the Instituto Pedro Curie in Cuba.
Good morning, good afternoon, ladies and gentlemen. It's a pleasure to be here. Now, I will talk to you about including social determinants of health, a forgotten component of universal health research, since 3 lessons learned in a project on dengue control, as David said previously. First, the universal health care and universal health coverage can be seen from different levels, different lengths, even different bags, because it depends on the length when do you see. Can be heavy or light. The universal health coverage is the thing, or was the theme for the last weeks for us and the last few days for you. But now I got in focus principally in basic social service. The main aspects about coverage as water supply and water disposal first, but I have to make mention too about the medical service and insurance. Well, the context of universal health coverage, we can talk about the last few days we are talking about reforms, delivery reforms, public policies, leadership reforms, but I'm focused in the access and the coverage of basic social service in all research. For that, I take the Colombian team today. The health coverage in Colombia is a little bit different from the other countries. We have maybe insurance, but we don't have access to that insurance. Why? Because in Colombia we have 2 kinds of insurance, a contributed one for the people that can pay, and the subsidized one for people that cannot pay. It means that in my country, the insurance is depend of your capacity of pay, and is not necessarily directly since the needs. Well, this is for make a context for you. In 2008, a multidisciplinary group joined to work in focus on dengue. Minister of Health, Center Research, and Education Institute. To what? To get in focus on dengue control. What are the project objectives of my project? Entomology system, epidemiology system, and develop a different way or system to get the focus control. I think that everybody listened about the last few days. And for us, was a surprise, the findings, because we think them are almost an empty picture. Why almost an empty picture? Because we found many lacks in the basic, in the social determinants of health. We want to improve the entomology system and the epidemiology system, but the lacks in the social determinants of health are bigger than the weight. We have found many lacks in housing, water disposal, education, healthcare service. I make mention in healthcare service. Why? Because the management of the case is different, dependent on the kind of insurance. We found problems, but we need solutions. It's always we say that we need solutions. And seeking that solution, we found 3 lessons learned. That is that I give to you today. The 3 lessons learned was addressing adequately social determinants of health. Why? We have to see the individual health as a completely whole view from 2 contexts. The social context, since the social determinants of health, and the clinical aspects, since the insurance and coverage that in my country is obviously separately for your capacity of pay. That gives to us the second lessons learned. The second lesson learned was basically go beyond the clinical aspects. Why go beyond the clinical aspects? Because you cannot expect that your patients take her drugs if he cannot read, or you cannot expect that they learn about the prevention if they can understand your messages. It's for that that you can go to beyond the clinical aspects. Look, the housing. The housing in our low and middle income countries is many times the basis of all our diseases. It's for that we have to go look at the housing and social determinants of health. And this, for make this, we have to go to the third lesson, and was work with the decision makers. Many times, the last few days, many people is talking about suggestions to work with the decision makers. But how many of us are working with the decision makers? In my example, I work with the decision makers since the beginning. Since the beginning to planning the project, to share the weakness, to seek solutions, and to establish solutions is the first or is the important thing. Because you can't find solutions, but you have to establish it. We have to join the hands and go beyond the clinical aspects. We have to include in health research the determinants of health in policies and interventions, and evaluate the social determinants of health since effective coverage, access and use of the coverage. We have to start with that. Well, the message that I have to you today is look behind the wall, searching the basis, work together, make a multidisciplinary groups, but it's not just talk, we have to make actions. And today I make suggestions because I have research, I have results. And today we have many people in our low and middle income countries that don't have coverage, don't have insurance, don't have access. It's for that I invite you to make work. And the last message is the universal health coverage must be improved beyond the insurance. Insurance is the most important thing in our lower and middle income countries, and we have or miss something components so important. Ladies and gentlemen, thank you for paying attention.